This is Dr. David Albert at the Digital Health Summit at CES 2020, and I have the pleasure of interviewing Phillip Dunkelberger, who is the CEO of a company called Knock Knock Labs. And Knock Knock, who's there, Phillip is very involved in data security, data privacy, and confirming your identity. And in healthcare, making sure it's your data, making sure it stays your data is critically important, especially as we move your health data to the consumer world. Phillip, please tell me about that, because it is critically important.
Yeah, the way that the internet works and the way that it always has worked is the fundamental issues concerning who is there. You know, we used to make the joke, is it a dog at the end of the line on the internet? And that has been a problem of authentication since the beginning of us really moving things onto the internet, because we don't have strong assurance. In areas like healthcare, where it's the most sensitive data you possess or is collected about you, it's really more imperative as we move that out of what we knew as hospitals, but who knew they were actually data centers all these years. As we move those data centers to a decentralized model to present goods and services to the consumer, perhaps in their homes, we need strong authentication to be a critical part of keeping their information private and accurate for the people that are working with them.
Well, tell me about that, because you know this show area at CES 2020 is filled with companies acquiring critical health medical data on patients in their homes, in their cars, while they're walking, and ultimately getting that information, if it's imperative, to a right caregiver, to somebody who can, and they need to make sure it's from Mr. X, Mrs. Y, and that it is valid data. How is that happening through what I would call the cloud and the local infrastructure, the browsers, the cell phones? Tell me about that.
Yeah, it's a great ask from an architectural standpoint. Where the industry has moved over the last 20, 30 years is a centralized model of computing, mainframes and minis, that we traditionally find in places like hospitals, to a decentralized model of bringing information both inbound from the patient, wherever they are, and round-tripping that information back to them. Simple things, like scheduling an appointment that used to take forever, now you can do it yourself. You can self-select scheduling. Payments, part of the payer system and ecosystems. We tend to think of healthcare as just one part of it. It's actually the services for health, when there's a number of other things that have to play, like payments, like prescription drugs. These are all different systems that now have to come together, and how that's coming together is what we've been working on with an industry group that includes people like Google and Facebook and Apple and Intel, international companies like NHS, standards bodies like the National Institute of Standards, is can we build something that is on your device already that allows you to set it up in a way that will tell them, signaling-wise, more explicitly, it's you. Using a series of biometrics that are stored locally, not in the cloud. Using cloud infrastructure in a way that lets we get the benefits of having cloud computing, but at the same time protecting the information locally. As I like to say, you don't go home at night and give all your information, your passwords, your keys to your car, everything, to a neighbor. You keep them locally, and that's how we're designing the new systems, to be on your devices. If they're lost, you simply get a new device, reinstate the keys. You don't have to have this big problem of redesigning the network to be able to use it more effectively.
Well, I appreciate you explaining that to us, because we're all very concerned about the validity of the data we're supplying and the validity of the data we're receiving. So, Phillip, thank you very much for explaining that. And again, this is Dr. David Albert at the Digital Health Summit with Phillip Dunkelberger and Knock Knock Labs. Thank you.